It's been 7 months. Almost 13 million people have been infected, and more than 567,000 have died due to COVID-19. As you're watching right now, the numbers continue to rise. So stick around and let's talk about how you can protect yourselves and your loved ones. Hi everyone, this is Liz and welcome to my channel. Here I will be sharing some of my travel videos, my artworks, some of which are behind me, my views on a lot of pertinent things or issues such as family, relationships, friendship, the art of gratitude, heartbreak, moving on, and basically anything under the sun. And since I belong in the medical field, I will also be sharing some health-related content like the one that you are watching right now. For this video, we will be talking about COVID-19 or coronavirus disease 2019. But first, it will be much appreciated if you would click like, subscribe, and share this with your friends. Okay, let's talk about the super virus of the century. The best way to protect yourself is to know what your enemy is and how it attacks. Thus, I decided to create this video. Alright, so COVID-19, it stands for Coronavirus Disease 2019, and it presented itself to mankind on December 2019. And after 7 months, it has already claimed the lives of more than 567,000 people all over the world, and almost 13 million people have been infected. So actually yesterday, the statistics was 12.1 million people, and today it's 12.85 million people. So in the span of one day, there have been more than 700,000 new cases. Well, there's the good news and the bad news. So the bad news is more than half a million people have already died. And usually these people die alone and they really suffer a lot. Many of the people who get critically ill, they require intubation and they require mechanical ventilation, and some even require dialysis. However, the good news is the mortality rate of COVID-19 is only at 4.5%, and 93% of the closed cases so far have already recovered. To date, out of the 12.85 million people that are infected, only 4.8 million people still have active cases. And out of those 4.8 million people, 1% are in critical condition, which means that these patients are in the intensive care unit or the ICU. And 99% of these active cases have mild symptoms, or some are even asymptomatic, which means that they don't show any symptoms at all. Well, unfortunately though, the not so good part of being asymptomatic carriers is that they wouldn't know that they are already infecting other people, even if they are not showing any symptoms. And the thing is, each person's body have different responses to the infection. So, for example, me, if I am an asymptomatic carrier and I interact with other people, I wouldn't know if one or two of those people that I've met or encountered will have really serious manifestations, or some of them even die. That's why, in this pandemic, we shouldn't just think of ourselves. It's time for us to think about others too. Well, how can you do your part in helping control the spread of the virus? Well, in any infection, whether it be viral, bacterial, fungal, or parasitic even, is to target the mode of transmission, because that's where you act, and that's where you can break the chain of infection. According to the World Health Organization and the Center for Disease Control, COVID-19 is primarily transmitted via droplet method. So it's as if the virus is riding the microdroplets that we produce whenever we talk, sing, sneeze, cough, and even when we breathe. That's why many nations are implementing the use of masks for all its citizens when they are outside. It's not just it's not just to protect yourself, it's more of protecting other people from you just in case you are infected and you don't even know it. However, there are some instances where the virus can become airborne. And in the hospital, we have what we call as aerosol generating procedures, wherein it includes nebulization, intubation, and extubation, among others. And whenever we participate in those procedures, we wear the full hazmat suit. You know, the ones where we look like astronauts. Also, many studies have been done which proved that the virus can also be transmitted, or the virus can also stay in fomites. So it means that after the droplets have been on the floor or any surface, the virus can stay on those surfaces for up to 72 hours. About 46% of those who have been infected are asymptomatic carriers. It means that they don't show any symptoms at all, but they can still be infectious. Those who experience symptoms have reported dry cough, fever, shortness of breath, some even have diarrhea, loss of taste and smell, body aches, headaches, and easy fatigability. However, the more serious manifestations may even lead to the patient being brought to the intensive care unit. So many of those that develop the more serious complications require intubation and being hooked to the mechanical ventilators. So the thing is, this virus is a really nasty pathogen or microorganism because it not only affects the respiratory system of the patient or the person that is infected, so it also affects the clotting mechanism of the body, which increases the patient's risk for developing strokes or clot formation, and it also attacks the kidneys. So we have had several patients who needed dialysis. And also, there are rare cases wherein the patients develop necrotizing encephalitis, which means that their brain tissues are simply dying out. And just recently, there have been confirmed cases of kids, young kids, developing Kawasaki-like symptoms, which can be linked to COVID-19. So it's basically like the inflammation of the blood vessels all throughout the body. Well, although only 1% of those who are still in the active cases become critically ill, I think you wouldn't want to risk that chance of having all these very serious complications, and actually some of them may be irreversible. And of course, we wouldn't want to be part of the 4.5% of the people who actually die because of the disease. So having said that, let's talk about how you can protect yourselves and your loved ones. 1. Social distancing. I cannot stress social distancing enough. I mean, everybody talks about social distancing, but why do we need social distancing? Well, the answer is simple. Droplets have a limited range of distance that they can travel. However, if the virus becomes airborne, that's a different story. We have a different set of PPEs, or personal protective equipment, for airborne method of transmission. And mostly it happens inside the hospital premises. 2. Cuff etiquette. So cuff etiquette is just showing respect to the other person or persons in the room. So regardless of the infection, whether it pneumonia, influenza, or COVID even, you have to at least be well-mannered enough or be respectful enough to cover your mouth. Please cover your mouth when you cough and when you sneeze. But don't do it like this, don't do it like this. Do it like this. Because if you do it like this and like this, of course, all the droplets will be in your hands. And of course, we use our hands very, very often. We touch a lot of things with our hands. And sometimes, even if you deny it, sometimes we do forget that we have to do proper hand hygiene. At least when you do this, I mean, you wouldn't even touch like this part of your body, right? 3. Frequent bathing and disinfecting. So what I always tell my family and friends is, whenever you go outside, the moment that you come home, you have to leave your shoes, your slippers outside your house and keep it there. And then don't sit or don't lie anywhere inside the house without removing your clothes from outside, and also at least take a bath immediately after coming home, when you come home. So at least just wash out all the germs that you may have been in contact with when you went outside. So actually for us, we take a bath before we leave the hospital, and then we take a bath again when we come home. Disinfecting is also very important, since I have mentioned a while ago that the virus has been proven to stay or stick in fomites or surfaces. So whenever we buy something from outside, like the groceries, like that, so we disinfect them first, immediately after we remove them from the eco bags or plastic bags or whatever you use when you go shopping. So you can use like any disinfectant on like non fruit or vegetable items. And as for the fruit and vegetable items, you can wash them immediately before putting them in the fridge or putting them on your table or your countertop or wherever you are putting all the things that you buy. 4. The use of gloves. Well, actually, we have seen many people wearing gloves outside, and it is actually frustrating that they don't know that using gloves for several hours or in everything that you do outside without changing them in between tasks will help you spread the infection more than when you will not wear gloves and you will often do hand washing or hand hygiene. We use gloves inside the hospital, and between tasks, we make sure to remove the gloves and use a new one. And every time we remove our gloves, we wash our hands or we sanitize our hands. 5. The use of masks. Many countries implement the use of masks for its citizens whenever they go outside. And it makes sense, because you protect other people from yourself, and those other people protect you from themselves as well. So if everyone will wear their masks, the spread of the infection will slowly fade, or at least we can be able to stop the spread of the infection. So how do the masks help? Well, since the virus is primarily transmitted via droplet method, when you wear the mask and you produce micro droplets, like you talk, you sing, you sneeze, you cough, and when you breathe, all the micro droplets will stay inside of your mask, and at least the possibility of it going out and spreading to the outside environment will be significantly lower. If everyone will do their part and wear the masks, you wouldn't even need the N95, and the simple mask or even the filtered cloth masks will be enough to help flatten the curve. In the hospital, we use N95 masks because we have more exposure to confirmed positive patients, and there's always a possibility that we will do some aerosol generating procedures. So now I have here with me like a sample of a surgical mask, which is the one that we are usually using outside, and the KN95 mask, which it actually provides more protection than the surgical mask. But like I said, wearing masks outside or in the social setting or in the general environment, it's more of protecting other people while they protect you from themselves as well. So what is the proper way of wearing a mask, especially the surgical mask? Well, since we are in a pandemic, and like this surgical mask and even the filtered cloth masks, the main purpose of these things right now is to keep the droplets inside and prevent it from going out in the open, so this mask, we have to keep the blue part outside and keep the white part inside. So when you wear the mask, other people, they use these ear savers, where they like hook the ear loop there, because after like several hours your ears will hurt from the elastic of the mask. But anyway, you wear the mask not like this, not like this, not like this, because it defeats the purpose of wearing a mask. So you wear the mask, make sure that the one with the hard part is on the upper side, and then you just fit it like on your nose bridge and pull it downwards so as to cover like the whole half of your face, and there you have it, you're wearing a mask. Although it will be quite a struggle for us wearing glasses because I don't know if you can see, but they fog up really bad. How do you remove the mask? Well, believe it or not, there's actually a proper way of removing masks as well. Because if you just remove it like that, whatever is sticking inside or outside of your mask, it will just drop on your clothes or on your shoes or whatever. So the proper way of removing the mask is leaning forward just a little bit so that nothing will fall on your clothes. So lean forward a little bit and just remove the loop from your ear, or remove the tie if you're using a tie mask, and just move it out away from your face. And then don't touch this, just touch the loop and then throw it away. So for hospitals, we use N95 masks, but I believe outside you can buy KN95 masks quite easily. So it's more convenient, and for those who want to have extra protection, so some people are opting to buy KN95 masks, although these are more expensive than the regular surgical mask. But yeah, for your own peace of mind, if you have the means to, I mean, why not? Nothing is holding you back from buying the KN95. So actually these KN95, same as the N95 masks, they offer at least 95% protection from viruses, from bacteria, fog, mist, or whatever. So the thing is, the difference between N95 and KN95 masks, first, N95 masks, they fit more snugly on your face. Actually, sometimes they fit a little too tight, and they have tighter bands that go around your head like that, whereas this KN95 only has ear loops. And another thing is N95 masks, they go through the US certification or something, whereas KN95, they basically pass the Chinese standards for masks. So anyway, we actually use this as a substitute to N95 if we have a shortage of N95 masks. So yeah, anyway, in wearing this type of mask, which is the KN95, again, you just put it behind your ear, and again, make sure that it will cover your nose and your mouth specifically. And if you can see the metal part here, you have to pinch it so that it will fit like the shape of your nose and the side of it, just to minimize the gaps as much as possible. And then yeah, compared to the surgical mask, this KN95 has a better fit, so it has a better seal around your nose and your mouth. And for those who have glasses, actually this is more convenient because our glasses don't fog up that easily with this kind of mask. And again, when you remove it, lean forward, remove the loops, and put it away from your face, and never touch this part, just the loop. So if there is a shortage of this one, so some doctors or some manufacturers have recommended that you can actually disinfect this type of mask as long as they are not soaked, or they are not soiled, or it doesn't get wet. So as long as you keep it dry and there are no spills or something on the mask itself, you can actually disinfect it according to some manufacturers. And you can, if you have like a means to disinfect it under UV light or any other sterilization equipment, all the better. But if you don't have the means to sterilize it using machines or equipment, so you can just put it under the sun and let it stay there for 72 hours, because that's how long the coronavirus usually lasts on surfaces. So after 72 hours, you can wear it again. But if there are a lot of you at home who are using this type of mask, just make sure that you will not like change it with another person's mask or something. So maybe you can label a plastic or a paper under it before you place it under the heat of the sun. So I would like to emphasize that the reuse of N95, KN95, or surgical masks is just a last resort. So you can only opt to reuse them if you really don't have enough of them. And the thing is, these masks are supposed to be disposable. So if you don't have any other choice, or if it's an emergency, still having a mask, even if it's reused one, it's still better than not having a mask, right? So as much as possible, actually, ideally, these masks are disposable. So yeah, if you have enough stocks with you, it's better if you use it for a one-time basis only. But if you don't have enough, then reuse it. Just make sure that it's disinfected properly or it's sterilized properly. Face shields are also readily available outside. So for the face shield, I don't have a sample with me, but if you're gonna use face shield, just make sure that it will cover specifically your eyes, because you already have your mask for your nose and your mouth, right? So you still need to wear a mask even if you're wearing a face shield, all right? Because the face shield still has a lot of space under it, so if you cough, if you sneeze, the droplets will just like bounce off, or yeah, they will just go through the gap under the face shield, right? So you might limit the spread of the droplets, but it's not as effective as still having a mask underneath the face shield. So since most face shields are reusable, before you remove, you have to remove them the same method that you remove your mask. Lean forward a little bit and then just touch the band or whatever's holding your face shield in place. Then move it away from your face and clean it with a disinfectant solution. First, the inner part, because it's the one that is closer to your face. And then after the inner part is clean the outer part as well, and then leave it to dry. Alright, for those of you who are still with me, thank you so much for giving me the time of day and for watching this video till the end. And always remember, it's not just the frontliners and essential workers who are responsible in managing the pandemic. All of us have our part in flattening the curve and eventually defeating this pandemic. I mean, all of us have suffered enough. We are tired. I mean, many people have lost their jobs, businesses have gone bankrupt, some stores have closed already, and I mean, for once, we have a huge uncertainty of what will happen to us in the future. So please do your part and encourage others to do their parts as well, and let's all work together in flattening the curve, in ending the pandemic. And yeah, I hope you like this. I hope you have learned something from this, and I hope it will help you in the future. And I hope you can share the information that you have gotten from this post to your other friends and family. So next, I will be posting a video like on the proper hand washing technique. I know it sounds so basic and so simple, but believe it or not, many people are still quite confused with the proper way of washing their hands. So yeah, I'll be posting that video very soon. So if you like this video and if you would like to be updated with my future posts, so just click the like button below and subscribe to my channel, and don't hesitate to share this with your friends. And that's it. Bye, God bless, and stay safe, everyone.